So I'm going to do a very brief synthesis of some 4 key highlights from this very exciting panel, and then I'll ask 2 brief questions, then open it up to the forum, and then the public for questions. So firstly, what I heard from all of you was the following. One is that it's in our interest to transform partnerships, to push boundaries, and transform the current model so that silos can really be broken down and more progress can be made. The second thing I heard is that there's interest in partnerships with the private sector, and they're not static. They change, and they're determined on a case-by-case basis. And we learned from the Tanzania experience that identifying a need gap was critical for determining whether or not that partnership was successful and a need. The third thing, or one of the third things I've heard, was public-private partnerships that are focused on healthcare have very important characteristics. And one of those characteristics is that they are people-centered, that we can't forget that they need to be people-centered, they shouldn't be transactional, and that's going to be very important in order to be compliant and to achieve the Sustainable Development Goals. And then lastly, what we heard from Natalia, and I think implicit in what Barbara and Omari also talked about, is this issue of measurement and tracking. How are we going to map and demonstrate the impact of these public-private partnerships that we're engaged in that have value for understanding from both the collaboration models, the struggles, and ultimately the impact it has on the Sustainable Development Goals? So those I think are the key insights in my synthesis of what I heard from you all today. And with that, I wanted to ask 2 questions. And I'll start with the first and open it up to you to decide who would like to answer it. So Barbara, you had mentioned that there's a core need for disruption. And a core part of that need was this need for fostering courage and compassion among those who are a part of these partnerships. And so that requires individuals really taking leadership, to kind of move beyond their own incentives or the incentives from where they work to push those boundaries to do something different. So I wanted to ask all of you, from your own deep experiences as being intermediaries and participating and leading these partnerships and witnessing them, both as participants, but also, I would say, participant observers in many ways. Have you seen this transpire? Have you seen this transpire in your roles? Have you facilitated that kind of courage and compassion in your partnerships? And can you share that with us?
Thank you very much, Alison, for a wonderful question. To my point of view, I think it's very well, clear that it transpires for both of us, but also from other sector that we are working through, the public as well as the private sector. For our point of view, we find it, some of the projects, because we derive it from what the government wants in terms of having 5-year strategic plans, and then from there we derive what are the issues that need to be addressed to fill the gaps. So we have a lot of private sector coming front trying to solve these kind of issues, and we get transpired by looking into what they need, but also what if it tallies with the government. So in that way, we get a good results afterwards in terms of you've seen the figures with regards to the performance of the health sector in terms of the health facilities, but also the openness. The leadership is also improving because it's open and it's free to even the community can be able to see these kind of figures. So for us, I think we are doing quite a good job.
For asking this question. I have many examples I can share. One of them I can share is, for example, the International Federation of Pharmaceutical Wholesalers. I'm mentioning that because this is an industry that people usually don't know so much about, yet in the US, for example, is distributing close to 90% of medicines. These are some of the major wholesalers working in the US, in Europe, and also starting to consolidate in developing and emerging markets. And I think that we had a fantastic experience working with the industry association and some of the members where the leadership was very strong from companies like McKesson or AmerisourceBergen or Walgreens, that over time that we initiated or co-developed the industry foundation that then led to development of first of its kind public-private partnership between those industries and the Gavi Vaccine Alliance that was announced at the World Economic Forum, that actually focuses on providing logisticians and trainings and improving, building the local capacities in Western and Eastern Africa. And this continues, and it has really evolved much further. And it's also wonderful to see that, that's the industry that has not been before involved in global health as much as their partners, pharmaceutical companies. But they have really persistently and continuously worked on these efforts. And they are, for example, now hosting the Secretariat for Fight the Fakes medicines. A very important initiative fighting the counterfeited medicine, which is the multi-stakeholder campaign driving this effort. So I think they are terrific examples coming from new champions that we do not often hear about.
I do want to bring up one example of a faith-based organization that's about 110 years old that has been putting together for up to 23 countries between $400 and $600 million a year in pharmaceuticals, and that would be the Catholic Medical Mission Board. So they've been around a while, they've been doing it a long time. Not a lot of people know about them, but they do have a solid footprint.
Listen, your question was about compassion, right? Yeah. I'm very passionate about public-private partnerships. I do believe in this modality, and I already mentioned that there is a lot of criticism. Let's be aware about this, but this criticism comes from the fact that we had mostly transactional PPPs, right? And now we talk how to make them transformational and sustainable. But we have to work with non-governmental organizations to make sure that the stakeholders' interests are met. We didn't talk about this today, but I think this is one of the success recipe for PPP. If stakeholder groups feel excluded, they are not asked about new road or new hospital or the way it's built, the way it's being organized, then probably this project will not be successful. We also need to maintain a dialogue with global NGOs to hear what they are saying, what is their criticism, try to accommodate this criticism. But I'm here criticism about PPPs. I always say this is like a marriage. There is nothing bad about this. It's just sometimes you have a good partner, sometimes you have a bad partner. I mean, it happens, divorce happens, but it doesn't stop people from getting married, right? So the same thing with PPP. There is nothing wrong with modality as such. It's actually about the governments. I think governments are in the driving seat to design good PPPs. That's why when I'm making my presentation, I think it's extremely important to work with them, and as I call it, phase 0, before the terms of reference are designed, so they understand the main concerns, how they should do it in a proper way, because they design terms of reference, and then the private companies are responding to those terms of reference. And if there will be sustainable procurement principles, sustainable architecture, and everything what I was mentioning in my presentation, then they will have a better projects. Thank you.
Thank you. This was really good commentary and feedback for thinking about what do public-private partnerships look like today? What can they look like for the purposes of really transforming them to be more sustainable and effective and creating the collaboration models we're hoping to see. So I have one other question, and then I'll pass it over to my colleagues here on the forum. So you all touched on the issue of equality, or actually inequality in some way. Inequality or the gap in access to care, gender, inequality, and digital inequalities. So my question for you is, based on your experience, what you've seen working in this field, in what ways do you think that these public-private partnerships that we've been focusing on for the past day and a half are uniquely positioned to tackle these issues?
To my personal perspective, working with the private sector, especially in healthcare, our more focus is not on the high-end people, like more people who are in town, but we focus more people from remote areas, so that to support the people who cannot afford healthcare. So we tackle issues that cut across all sectors. For example, if we support populations, we support it, but not looking to the how much they earn. Rather than, there are certain kind of population which are supposed to pay for the health insurance. For example, children under 5 and women who want to deliver, and elder populations are excluded to pay these fees, so that the services are actually free for them. The other group of population are not forced. Of course, they can get the basic health service, but are not forced to pay also health insurance. So inequality is actually addressed across all, so that everyone have equal access to health care. Although people who there are also, some of the hospitals are made into 2 different categories. One arm might be for people who have much money to pay, which they can get more service, and that money can be used for the poor. For example, we have a rehabilitative hospital, which has the private arm, but also the public arm. So the private arm, they get good service in terms of care, in terms of time management. But those money are also tackled down to support the community. It's not for the hospital to earn. So I'm not sure if that is inequality, but that is some distribution of what the hospital can generate to support the rest of the. So most of my work actually we support people who are not maybe able to pay for, and we cut across all the population. Thank you.
Yeah, I can just add that they are absolutely essential. There is no doubt about it. But I think there is not yet enough both public and private actors open to that. There is a lack of knowledge and information how to do it. So I think that forums like here, it's really important that this information is distributed and shared, and it really plays a unique role in sharing this information to those that are not here and promoting this knowledge. I think it's also essential that it really is about knowledge and awareness, that this knowledge and awareness is accessible in public health training, schools, other programs. It's still not there. There is a lack of knowledge how to make this happen, why this matters. Government officials are usually not trained and aware about that. So I think there is a lot of knowledge sharing that needs to be done in order to help foster that successfully.
You probably heard about principle more for more, right? More for more, yeah? I used to work in the European Commission, and we had this principle: the better country is doing, then the more money it receives. Yeah. So I just wanted to reformulate less for less. So the more you're expelled from the system, the less actually chances you have to healthcare and other social services. And I know some examples in some countries when people don't have birth certificates. They are not officially exist. How they could access the healthcare system if they are not on the track? So basically, I think this is the main function of government and also of public-private partnerships, to make sure that they are addressing especially those most vulnerable groups, and need to address inequalities in a very systematic way. And it should be one of the imperatives for public-private partnerships.
Thank you. So with that, I'd like to open up the opportunity for those from the forum to ask any questions. Okay, Kathy?
Thank you all for your talks. That was really got me thinking. I'm actually going to ask a question from my colleague. He had to step out for another meeting, and he asked me to ask this of you, particularly Omari. So, but I would like to also further discussion, if there's time, on equity. I think this is just a really important topic. So this question was kind of specific about what's happening in Tanzania with respect to government support for the faith-based health delivery system. And we have heard, can confirm or deny, that that funding is actually being redirected so that the government's prioritizing building their own new public clinics over the support of the existing faith-based. Is there any truth to that, or can you just comment on that?
You are absolutely right. We have 10 different cases that the faith-based organization have the hospitals somewhere in small towns, but also afterwards the government comes back and build another hospital. So this is a kind of confusion. We also a lot of discussion go on between the private sector, a lot of forums on the government to make sure that this does not been made. I mean, the buildings should be distantly enough to support different communities. And the major reason is we had drastic change of the political personnel after 5 years, after sometimes you can even after 1 year or 2 years, and everyone has different agenda trying to win some votes. So there's a lot of pressure also from the political aspect that if you build a hospital, you get more votes and can be back to the business again. So the FPOs, they have more than 100 hospitals, and 2 of them are the major referral hospitals in the northern zones, but also in the lake zones. So, but 10 of them, there's still confusion. A lot of discussion going on. Especially, there are also cases of the Islams does not want to get into the Christianity hospitals because of their faith. So that's also a lot of kind of misunderstanding. So that is quite true, but a lot of things are going on to discuss, not to do more on that area.
I'm also in touch with medical store department of Tanzania, and I would like to share with you information that they are preparing 3 PPP projects. They would like to build free pharmaceutical plants. The problem in Tanzania that about 90% of pharmaceutical is being imported. And this is a question of national security, basically, to establish the local production. And we had some guests from government of Tanzania recently in Frankfurt, and they presented their projects. And we're wishing them a lot of success, of course, in this very important task.
Thank you. Yes.
Good, Julie.
Julie. Oh, sorry. Do you have a question, Julie?
Go ahead.
Good morning. My name's...
Yes, there's a microphone on the left, on your right. Thank you.
Yes, good morning. My name's Mark Rasmussen. I work for an organization called DAI Global Health. It's based here in Washington. And thank you for these presentations. They were great. I had a couple of questions that came out of them for me. One of them pertained to brokering PPPs. I mean, I appreciated the presentations by Natalia and Barbara. It seems like that's one of the kinds of things your organization helps do, to kind of bring together interested PPP parties to broker agreements. And I just wanted to ask you, what are the modalities? What's your experience in, I mean, obviously your organizations help do that, or the UN seems to help do that. Are there other modalities that you have found effective as neutral brokers, bringing together government and non-government and private sector partners to facilitate the process? The second question is related to your presentation, primarily, Natalia, and I really appreciated your bringing in the perspective of planetary health, sustainability, resilience. And my personal view is, given the climate emergency, this is context that is really compelling for every PPP. And I just wanted to ask your kind of experience, is that happening as you are consulting with groups that are helping PPP development? Is that perspective coming in and becoming a common framework? Thank you.
I have very good news for you. Actually, there is a PPP Resilience Center based in New Orleans, the area which was suffered very much from the climate, And there is a colleague of us who is, this is a UN-affiliated Center of Excellence, which quite specifically advises on resilience issues. And it's based here in the United States. And by the way, US is quite a champion in resilience because of your climate situation. We in Europe, we just have to learn. We are not doing much in this regard. We organized earlier this year in Singapore the workshop. It was an Innovate for Climate conference organized by World Bank. And we organized the workshop on climate resilient infrastructure. And if you're interested in issues like this, I would suggest you to attend the next Innovate for Climate event. It will be in Barcelona this summer. And the next question was, if you allow me, then I will jump to the first question about modalities and how to broker partnerships and so on and so forth. We had a short chat with Alison before the panel starts, and I told her that I have a background from non-governmental organization as well. So I like to engage in partnerships and broking people, bringing them together. I see the value in doing this. And that's why it was my personal initiative to have this working group on partnerships within Global Health Hub Germany. And the idea is actually to broker such partnerships. The beauty of this hub is that we have really top companies and top providers in Germany. Idea to start it from Germany and then to expand it on the global level. because a lot of companies are actually doing PPP and all kind of partnership projects, not in Germany, but outside of Germany, more specifically targeting African countries. And we have a very interesting initiative which is funded by GIZ, which is mandated body of government of Germany. It's called Multi-Stakeholder Platform. What they've done, they basically provide methodology how to create partnerships. There are some visuals, there are some trainings, there are all kind of materials which could be basically used by anyone who is interested in how you approach the issue of creating a partnership. And I think the tool that I mentioned, this database, this is specifically for healthcare, only for healthcare. Idea is that we will give a validated access to the stakeholders, for instance, government of Tanzania or philanthropic institution which making partnership projects, and they encode their own information. And then it will be cross-validated, like in Wikipedia, and then we will have a stock of information, and we will see who is doing what. You would then have an idea with whom you would like to partner, what kind of projects they are doing. You might have inspirations for what kind of projects you want to do. Thank you.
Yes. Thank you for asking this question. I think it's very important, and I think there are many, many modalities to make this happen. Sometimes they are neutral, like in our cases. We consciously went out of the organizations, or at least in my case, either public or private, where I was doing that before within organization. So it's also important to say that, for example, in our case, when we are helping catalyze the partnership, very often we would help together envision what this partnership would look like, and then eventually or gradually the purpose is also that you build the capacity with partners. So let's say if this is several partners developing a public-private partnership, it's really essential that they build internal capacity. It doesn't matter which partner, they all should. Somebody needs to be a champion or two, otherwise it will eventually not continue. So if you are a neutral broker, then you continue to some extent based on what the needs are, very methodically, and the purpose is you help build the capacity. And there are also, as she said, there are also institutions or organizations like Partnering Initiative that help provide training to do just that, because this training is indeed lacking.
Hey, Julie?
So I'm definitely not a PPP expert at all. So this question may be humorous more than anything else. But I was in Omari's talk. You talked about the what do you call it, the prime vendor, and all I could think about is Amazon. And I started thinking about how is there ever been a situation with PPPs where one partner on the for-profit side got assistance on the public side, and that there was ever a situation where they said, oh, wait a second, this person has gotten undue support, and it has created conflict or other in a country where one for-profit actually made a lot of money over this PPP on the side, that maybe that wasn't the intention. Is that ever caused a conflict or a problem as you're putting together the PPPs? I know it's a weird question.
Yes, it's a good question. Yes, at the moment we had this problem with the prime vendor. So at the first instances, the health sectors were allowed to purchase the unfulfilled medical supplies from the private sector. And these health facilities were just randomly choosing who is around so that they can purchase. And that was not so efficient in terms of costs, but also in terms of time, in terms of trust. There are a lot of bureaucrats. Someone who is procurement officers can make deals with those vendors. And then that was a total failure for the system. So then come afterwards, we had this. Then people have to sit down and select the best option so that they can purchase. And so as the government and the other sector, the private sectors, identify or set the limit of the cost of different supplies of medicines and equipments, and they select one potential a vendor. So the rest of the vendors, if this potential vendor does not have other supply, they have another contract with the other private sector so that they can provide in one area. And that reduces time for delivery, but also the costs were known to everyone. So there's no fluctuation of cost, no time wasting, and the service was perfect because this vendor was able to provide everything in a specific time or period. So, of course, there are other cases that, especially when you enter into contract with the government, in some areas you can be able to purchase, for example, dialysis probably in towns, and you provide this in your own buildings and get into the contract with the government that for the patient who need dialysis or patient who need X-ray, ultrasound, in those areas they can be transferred to your facilities. And in that case, there's a lot of discussion what the cost should be. In the government perspective, most of the costs are covered from the government. They don't include other associated costs like services, the human resource, power and utilities. So they set down costs that can be afforded by the private sector. So most of the contracts were not efficient. So we had a lot of problems trying to solve these issues. And most of the time, our politicians have upper hand. If they say something, even though it's all right, sometimes kind of difficult to resolve. So we have some sporadic cases that they're also trying to have a conflict in terms of profit. But also it's more of mindset from the public sector, that they always think if you are private, just because you're private, you make money from them. So that is big problem with us.
Thank you, Amari. Kathy has a question?
I have one more question, and if we're running out of time, we maybe can move this to the round table, but let me try to get it out while I sort of have it in my mind. So I'm struggling a little bit with the concept still of equity and how we can really think about public-private partnerships serving, as you said, the ideal, the most vulnerable populations, et cetera, et cetera. I mean, typically, the private sector is interested in markets, and markets are people with money. And typically, the public sector, and this is how I think about it anyway, has had the poorest of the poor have had a public sector safety net, so that the National Health and Service might just cover that population while others have private insurance, et cetera. So I think that's the way a lot of us think. So I'm just wondering how it is that these most vulnerable populations and PPPs are actually attractive to the private sector, can be made more attractive in the sense that they're either in the sense of a whole government that may not have that enabling environment quite in place yet, or in the sense of a small community that represents the most vulnerable who may not really represent a market. So that's what I'm struggling with. I mean, our ideal is this, but I just see perhaps a lot of different forces maybe pushing back against that.
It's a good point that you're trying to make, and it's really valid to me and to the country. So far, we have only one successful private sector with the government. If people only in the private sector get into contract with the government, and that they get a little bit assured of the money coming back. For example, in case of the poor, the supply chain is one which works because people who are supplying the private sector, they're not dealing with the patients. They're not dealing with the community rather than they're dealing with the private sector. That's why you can be more successful in trying to engage the private sector to make more profit for the business and also to be sustainable. But most of the PPP in my country specifically, they are more of NGO, faith-based organization, exactly, with the government. So they are not into cash-based or profit-making institutions.
Yeah, I can just add to that yes, it is a real challenge, practically. And very often this is done not through the core business, but it's done through the corporation's foundation or CSR programs. And clearly this is a small segment of what the business can do, but unless there are some incentives from the enabling environment, it's very difficult to challenge that. It is, and then it also, I think, it's very dependent on the kind of companies that are able or can take some higher risks. It varies by the industry. It varies by the corporate leadership, by the board. Is it company public or private, and so on and so forth. But I think what is very promising is to see changes in corporate strategies that are bringing those initiatives into their core businesses. Some companies, like for example, a good example is Unilever with Sustainable Living Plan. It's also through delivering good through brands, or companies that you may not know so well, but are really forward thinking in those areas, like Royal DSM, is one of the largest vitamin providers. It's also business to business, but really forward thinking the way they are addressing those challenges by making co-investments in developing manufacturing facilities in countries to try to reduce the costs of production. So there's some good examples in those areas. I think I think the challenges, especially in emerging economies and transitional economies, where the primary motive is to generate profit tomorrow, that in the large part of the world there is a lack of ambition from a corporate sector in these areas, but also from a government area to actually enable that. That's why I think it's so important that we raise these issues and communicate that this is really the way to solve it.
Thank you, Barbara. Simon has a question.
Really just wanted to comment on both Julie's and Catherine's points, if I could just quickly. I mean, Julie, your question, when I think about when this forum started and where I came from the public sector, 30 years with the British government and then the UN, and I can remember a time when we were basically forbidden from talking to the private sector. There was no conversations at all because of this fear of unfair competitive advantage and not using public resources. And that dialogue has moved on considerably, but it is still a question and concern. And I know when we heard from Kenya yesterday, I saw contracts up there that I remember being discussed when I was in Kenya 17 years ago that are still being discussed, and issues around unfair competitive advantage was part of why things got stalled. So I think it's a very legitimate question. I think from my perspective of what you're saying, there are lots of market failures. The market isn't going to deliver the services and the products and commodities that those left behind and vulnerable need, and therefore what are the ways in which we do that? One is around changing the incentives. So if you look at, and we had a conversation 2 days ago about potentially thinking about innovative finance. But things like advanced market commitments, volume guarantees, the AMC for pneumococcal vaccine, for example, really sort of changed the dynamic in terms of production capacity across a couple of places in the world to provide commodities that otherwise wouldn't have been done. And that was very much a public-private sort of blending of incentives. What we've tried to find in this forum are opportunities and ideas and lessons of where actually a partnership between the public and private sector provides those public sector global public goods, if you like, but also in a way that creates shared value. So it's also value beyond CSR to a company's bottom line. And, you know, I think we're still, I hesitate to say infancy because people have been talking about PPPs for a long time. But, you know, the value of the forum of today and yesterday is trying to learn some of those examples and think through how we might stimulate and promote those, you know, even more. But I think it is that real challenge, Catherine, of trying to find ways in which we can provide. You know, we still look at Africa in many ways as this sort of left behind continent, and actually it's this huge marketplace. I mean, and growing marketplace. And I think if we can change our perceptions around risk and then capacity to develop bankable projects, that's where real sort of investments and shared value could come from. Thanks.
Thank you, Simon. I think we'd have time for one more question. If there's anyone from the public that has a question. Okay, great. Thank you.
Good morning, Luc Klecht from Philips. Barbara, thank you very much for showing a slide on bees. I'm a beekeeper, so I'm always happy to see that people are talking about bees because no bees, no life. Going back to partnerships, bees, in fact, if you put different populations together with a strange queen, in 48 hours they develop a partnership and they share responsibilities, they share risks, and they share benefits. So I have a question, in fact, for the panel. I don't know if it's for the discussion later, but my question is why you think that PPPs in health are so difficult to develop. And I will give you first my opinion out of our experiences, where when we explained yesterday that Philips has done a study about emergency obstetric and newborn care, that we had the first success 8 years ago implementing a program with WHO, UNICEF and UNFPA in Namibia. Over 8 years, we tried to do it with other international NGOs and local NGOs. And now we are back doing an EMOC program with UNFPA in Congo. And again, we are successful. So that made me think, and I believe, and you can correct me if I'm wrong, is that in private, we have a strategy. So I take example of Philips, of course, where we have a strategy around solutions. So I have modern childcare, oncology, cardiovascular. This strategy was developed 5 years ago, and we still have the same strategy. In UN, you see that UNICEF is taking care about children, UNFPA about mothers, World Food Programme about food. And then I see other NGOs, which we worked during 6 years. Today, their strategy is EMOC. Tomorrow, it is TB. In 2 years, it's another disease. So there is like no sustainability in those in those other NGOs. And as such, I think it's quite a struggle to have like sustainable partnership. I'd like to have your idea on that also. Thank you.
Thank you for saying that. I think you explained it very, very well. And Philips, in fact, is one of those companies that is really at the forefront of, I would say, being creative and strategic how to make the partnership happen. And from my experience, I think in health in particular, sometimes it's incredibly frustrating, much more than in other areas. And I think that in part is the health profession is very regimented, it's very hierarchical, the way people are trained in health, and very often, there are health professionals dealing with that. So I think that is for sure one reason. It's very different when you work with more horizontal industries like IT, or when I see in food space, how this is, or urban planning, not even mentioned, where the stakeholders are involved from the beginning. It's entirely different mindset. So I think the mindset is surely one of the big opportunities to change. And I think also people don't speak up. I think that's fascinating to me, that people in health space, they're afraid to speak up, say what is what. So I was very happy to hear yesterday very frank and honest conversation. I think we need more of that. And I think there is a real opportunity, which is still a huge challenge, is this transdisciplinary thinking, to bring in other professions at the table, creative professions. Why it's very difficult for me. I mean, both private industries are better than public sector. But also very challenging. I can share example. A few months ago, I was at the World Economic Forum in Geneva. The first time they convened chief strategy officers from all their member companies. And it was very interesting. So they invited me and a few others as kind of disruptors, bridge builders. And there was a health session on that. So there was different industries, for example, from IT, from food. So a lot of players that we don't see here at the forum. And I was surprised that at that level, the chief strategy officer, there was still very vertical thinking. Why? Not surprising, because there is a plan they need to deliver. There is a quarterly reporting. Very difficult, so they don't even have time to think broadly. But there was an openness, and I was interesting to see that from the IT sector there was more openness, depending from which industry, and of course depending on personality. You can always find those people. That's why I keep stressing, who are those leaders who are not afraid to say what is what, who can see broadly, who can also in the healthcare push boundaries much further, and that's what's needed.
Thank you, Barbara. So thanks to, Amari would like to have some final words.
Yes, I want to add for your comments with regarding to, I think the main issue is the health sector is multi-sectorial. For example, in my country, you cannot deal with the health sector alone. You also need to deal with road infrastructure. If a woman in Emok, you want to go fast to the hospital, you have to make sure that there's a facility to take this woman to those areas. But also you need to deal with other services like power. You have enough power in the remote areas. We have more than 60% of the country now is powered by electricity, but what about the 40% of the population which are not covered? So a lot of issues need to be considered, but also financing, planning in the Ministry of Finance. They can probably talk about, we are going to provide certain kind of money, but at the end of the day, they give you half. And so there's a lot of issues that need to be addressed. But on the other side of the private sector, I think if you want to really solve health issues, they are long-term. And most of these private sector, they are quick in making changes or make results. So if you want to really reduce maternal health in the country, you should talk about several decades. I mean, this is how we should discuss in terms, but you can't have that quick fix and then you expect sustainable result. That's not possible.
Thank you. So we're a little over time, so I wanted to thank our speakers for their engaging presentations. We're going to be taking a 10-minute break to do some reconfiguration in the room, and then we'll continue our frank and open discussion around public-private partnerships.